Everybody should be able to see slides now. While we're waiting for the last couple members of the CAARN team to join, um, I just want to thank you all for joining us today. I know this is something that is probably new to everyone since CAARN received funding this year to support more assistive technology projects, research for across the schools, pharmacy, School of Medicine, School of Nursing, of course, the College of Engineering, and the School of Education. So we're very excited to be able to offer this new funding opportunity for those that have these awesome new ideas for ways we can help the health and function of older adults. So, okay, it looks like Jane's with us, and I think it's just Dorothy left. So we'll kind of break this up today. We'll try not to spend too much time presenting. We want to provide plenty of time for questions from those that are attending and learning about this opportunity. But at the same time, we want to make sure that we hone in on a few of the details here that should hopefully help prepare you for potentially applying. So I will kick us off, and here we are. We got Dorothy now. So I think the full CAARN leadership team is here. So that would be Jane Mahoney, Barb King, Dorothy Farrar-Edwards, and Hungru Zhang. So thank you all again, and let's go ahead and get started. So the new pilot award program for sponsored through the National Institutes on Aging, which is flowed through CAARN. It's called we've called it the Prototyping Assistive Technology with Community and Health Partners Pilot Award Program. So the purpose of today is to first emphasize the importance of early engagement with community and organizational representatives for research. In particular, we're talking about assistive technology enabled in order to make our technology acceptable and usable for those that we intend to use it. And then after Dorothy will highlight the importance of that section, and then we'll talk a little bit about the elements and overview the assistive technology pilot funding opportunity, so the request for applications, so some of the key sections in there, the letter of intent, and really what you should be thinking about and planning for if you do end up planning to apply. And then we'll also want to answer any questions you all have regarding the eligibility, this letter of intent that's coming up in the end of February, the full application, and then if there's anything related to CAARN in terms of its services and processes and how we can support researchers, and then also the review and scoring process for each of the applicants. And lastly, if there's time and as we sort of get into questions, we can highlight how CAARN can be a key resource to you and how it's meant to support, again, you as researchers applying for this funding. And as I start here, I think it will work better because we're not going to have a long presentation to try to hold off with some of your questions till the end. And we can go back to those slides if it's pertaining to a specific part or section of the application. So just make a note or put it in the chat. I think we have a couple CAARN people looking at the chat and can help bring us back to it. So just quickly, what do we mean by assistive technology? We sort of have a broad definition here, but what we mean by assistive technology are the products whose primary purpose is to maintain or improve an individual's function and independence. So they can help individuals communicate, function mentally, hear, see, move, or care for themselves. And so it enables people to participate in education, work, and community activities, live more independently, or reduce or eliminate the need for support from caregivers. So the overall goal of this pilot award program is to reduce health disparities in using assistive technology that addresses a specified community need for older adults. And within that, we have really kind of two specific goals, and that is to fund activities to further develop and refine assistive technology, your prototype, and ensuring that the proposed technology is acceptable to use in various community and clinical settings through continuous iterative input from diverse stakeholders. And then we consider the ergonomics and culturally sensitive paradigms in doing that. And it also enables investigators to help conduct initial tests of feasibility and usability of the proposed technology with the actual users or human subjects prior to large-scale and clinical testing of the usability and health outcomes, and hopefully the eventual application into practice. Okay, I'm going to turn it over to Dorothy to talk a little bit about why it's so important that we engage communities and make them a big part of the research.
Thanks, Will. So the CAARN Award from the National Institute on Aging is unusual because it calls for, very clearly calls for true partnerships between community organizations and individuals and those of us who are interested in developing and testing assistive technology. So this is uses a sort of a partnership model where the technology development is done hand in hand with community partners who are going to advise on the utility and usability of the technology. So this is a little different than most pilot programs. So we are calling for meaningful community engaged methods using a user-centered designed approach. We expect it to be very iterative. So, a device is developed, get feedback from individuals, who are interested, who have need for the technology that's being developed. Then it goes back to the lab for further development, then further testing, so it's an iterative development, but a true partnership. So community engagement really is the process of involving individuals, caregivers, engineers, computer scientists, all of us interested in this through the entire research process with the idea that nothing for us without us. And this has been a hallmark of CAARN research since it was funded. We've found it to be a very, very important model, but also a very successful model. So CAARN has a history of successful extramural funding for projects that are developed using this community engaged process. Next slide, please, Will. Okay, so we have in the years that CAARN has existed, develop a network of community organizations as partners. So we have partners available for investigators to connect with. We have developed research projects with those individuals, and then we've worked with them and resources in the School of Medicine and Public Health and elsewhere in the university to incorporate designing for dissemination and health equity. So these are essential parts of the design, and that's actually what we believe will make the development of this assistive technology more competitive for extramural funding, for one thing, but also more importantly, more acceptable and useful to individuals in the community that we're hoping to serve. Next slide, please, Will. So the projects that for these pilots, projects should aim to maximize the use of technologies to improve older adults' function, health, well-being, and reduce disparities, just what Will said in the introduction. But you have to involve individuals with disparities due to race, ethnicity, geography. So here we're talking about our African-American rural partners, socioeconomic status, health literacy, and cognition in the design and testing of any intervention. This is why one of the reasons that why our project was funded. We attend to issues of ability, feasibility, and acceptability of AT among diverse users. As many of you know, a lot of assistive technology is abandoned and not used, and we want to end that cycle of creation and abandonment. We need to consider and mitigate the risks associated with assistive technology, including loss of privacy, reduced access to healthcare services, and potential for internet-based AT to fail or be disrupted. That doesn't mean that we're not open to innovative techniques that that are online or use social media. Next slide, please. I think I'm going to turn this over to Barb. I think is Barb who's going to talk about the key dates and info. Am I correct about that?
Maybe we're gonna have Hungary
Oh, Hungry, sorry,
overview.
Hungry.
Yeah.
I apologize.
It's all right.
Um,
Thanks, Dorothy. Thanks, Will. Okay, so I'll spend a few minutes on the overall review of the pilot this mechanism as well as the process of submitting a proposal. So here are the key dates and information. Funding level, direct cost, $50,000 is very much in line with pilot projects that we've seen, especially close to College of Engineering, and I believe across campus as well. It's 12 months with possibility of 6 months of no cost extension. It's a multiple step process. We have a letter of intent that is pretty much required. That is due February 28th. And then full application is due Monday, April the 14th. Then we'll have a review process, and the notification of award will be June 20th. And earliest project start will be July the 1st, 2025. That's the start of the fiscal year. Next, please. Eligibility. So it's kind of is we tried our best to broaden the pool, the contact PI. There's really not too much requirements except that the PI must hold a UW-Madison faculty appointment or scientist title. So there are some details as you can see over there. Individuals who do not meet the criteria for PI may serve as co-investigators or other key personnel. Proposals must include at least one UW-Madison College of Engineering or Department of Computer Sciences faculty or scientists as part of the project leadership, so which means it must be PI or co-PI. In other words, that person needs to hold a significant role in the project. The proposal can include multiple PIs or MPIs, but one person must be designated as the contact PI. There are some other restrictions. Minimum contact PI may not be the contact PI or MPI on the active CAARN grant award. Serving as co-I or other key personnel is okay, not excluded. Or this person has not been the contact PI or MPI on another CAARN grant award application submitted during the same cycle. Next, please. Okay, general overview of the pilot program. I'm not going to read every single line. There are things that are pretty in line with every grant, pretty much. For example, especially dealing with health needs. For example, it needs to address emerging or critical health needs. The research needs to be rigorous, clearly defined. If you have done any clinical research, you'll notice that there should be clearly defined and promoting research and education into the clinical and practice. But as Dorothy emphasized, we do have some uniqueness of this program. That is, we do emphasize on the user-centered design, engagement with the communities. So the other items you see here reflects that requirement. Next, please. Okay, so as I mentioned, this is a multiple step process. The first is letter of intent that's come up February 28th. The letter of intent is not reviewed or ranked, but serve as the purpose they serve is for us to find whether you are eligible, whether it's falling into the scope of the program, and to potential identification of proper qualified reviewers. So the LI, maximum 1 page, single spaced. You can see there's some requirements on there. So once you have submitted the LI, we'll try our best to get back to you within 5 business days to determine eligibility. If you are eligible by Monday, March 10th, the contact PI will be contacted and invited via email to submit a full application. Next, please. Oh, sorry. Will, can you go back? So if you're interested in submitting an LOI and would ask for help from CAARN, about community engagement or general consultation of the program, please do contact Will. His email address is right there. Thank you. So next, suppose you are eligible and you are interested in submit a full application. The deadline is April 11. So you might be familiar if you have submitted NIH proposals. So it's somewhat in line with a lot of NIH grants, but we do have, again, some uniqueness that addresses the specific needs of this program. The full application will have 9 components. They are listed over here, and we'll have a few slides talking about the unique part of it, specifically the community abstract, the background information, etc. Most importantly, pay attention to the page limit. The narrative or the description of the project itself has a maximum 6-page limit. Next, please. Okay, so the first is a narrative, probably arguably the most important component of the proposal. So these are the sections that needs to be addressed, and please include these sections in this order. Specific aims, background significance, innovation, innovators, environment approach, community engagement and collaboration, dissemination plan, and future considerations. Most of these you're probably familiar if you have submitted NIH proposals, but you do see a few more that is unique to the program, and we'll have a few more words to say about it. Next, please, Will. Okay, so background significance that is specific to this program. Make sure you describe the problem the older adults are facing that your assistive technology could address, and describe the knowledge and or the equity gaps this proposal intends to address. Who are the intended users of your developed AT? Provide evidence or describe or provide any evidence that shows that the end user feels that the work you are using is indeed needed and could be helpful to them, and that they are willing to be engaged with you during this whole research process, not only the pilot project itself, but also beyond. Make sure you include any description of the involvement or engagement that you have with older adults and users, caregivers, community clinical providers, or other impacted entities. Describe any feedback that you have obtained from the community partners or study population on the proposed assistive technology development work. And make sure you describe the potential long-term impact of the research. Next, please. So in the approach, it's very similar. Of course, it's a scientific research proposal, so have include methodologies, address rigor, all those kind of things. I don't need to repeat that. But keep in mind as well is that the community engagement and the need to address inequities in Wisconsin older adults should be reflected in the proposal, in the description of their approach. Next, please. The section of community engagement and collaboration. So make sure you describe how organizational partners, that includes collaborative community and or clinical organizations, or relevant individual community members, for example, older adults, caregivers, partners, community care professionals, and make sure they are meaningfully involved in the proposed work. This reflects the theme of our whole project and the overarching theme of the project, which is the user-centered design process. Make sure you describe these community partners' roles in the project, and how these partners and the entities will be impacted, how impact entities will be identified, how they will be recruited, and how they will be engaged, if they have not already been. Describe how partner organizations will contribute to the success of the project and the ways in which this project will benefit from this unique features of the community partners organizations. And make sure you describe how community partners' preferences, their feedbacks will be taken into consideration during the whole process of the research activities. Next, please, Will. I believe this is Barb now.
It is. Thank you, Henry. The RFA provides a lot of detail in the budget sections. So make sure that you refer to that RFA during your application. Just to highlight a few things regards to UW-Madison personnel. So this, make sure that you include, I'm looking at the RFA right now, make sure you include effort for each individual that they'll be contributing towards this project. And then if fringe benefits are part of that effort, that has to also be included. So that could be for co-Is, mentors, collaborators, student hourlies, research staff. Graduate students and postdoctoral associate stipends are allowed for this work under this pilot. So if you have a graduate student and you're going to put them on as your PA, you'll have to do is include tuition remission within your budget. In terms of community collaborators and or contract costs, you want to list all of your community collaborators that you're going to have on this your proposal and what is going to be their role. So under the justification, you're going to want to spell that out quite a bit. What is their role in this project? You can include payments to individuals and or organizations that are outside of the UW-Madison campus. And these payments could be in the form of stipends or they could be fee for service. Make sure that your compensation to the community partner really is in line with their contribution to the proposed work. You also want to say, sometimes you'll have people say, well, I don't want to get paid for this work, or you have an organization that, a group within an organization that can't accept payment. But maybe there will be something else that you'll be able to provide for that group. So you want to be able to justify the purchase of a product for a particular organization as part of their payment. In terms of research participant costs, which should also be part of your budget, you really want to include any costs that are associated with paying research participants for being part of this project. You might have to include travel. You might have to include parking as part of the cost. Your population, maybe you have to include childcare if that factors in to your cost to actually do the project. So anything that directly to participants that's really for the purpose of the study, you want to make sure that you include that. If you are remunerating research participants, it has to be in your IRB and it has to fall under the approval. We have to be in line with what IRB approves. In terms of supplies and materials, you can put into your budget any materials you need or computing supplies, research equipment to actually do the project. But they have to be essential for the study and solely used for the study. And they're materials that you don't have ready access to otherwise. Please remember that large equipment expenditures over $5,000 are not allowed because university criteria is when we start purchases over 5,000 have to have justification and actually have to go out for bid. So you want to keep that in mind. Travel, you can include any travel that's made by UW personnel. You might have to send people out to sites, and so you want to be able to recruit for mileage that individuals have to incur for travel. And then any other expenses that maybe don't fit in any of these categories, you want to include those and also include justifications. And we also have a budget template. Please, we ask that you use that template when you submit your proposal. And then the budget justification, oh, sorry, Will, the budget justification, just make sure that you include all information listed to these expenses so that we can see the alignment with the cost. This is the cost and here's the why. So that, and then follow the same format that you're following in your budget table. Next then. So these reviews go through a two-step. We have a scientific review committee, and then we have a external committee review that also look at these applications. We use the NIH format, the 9-point scale, 1 exceptional, 9 being poor scoring system. And we'll also be looking at these peer-reviewed framework, looking at these 5 regulatory criteria that you see in NIH, looking at significance, investigators, innovation, approach, and environment. And again, the RFA has a really nice description of all of these 5 components. So there'll be an overall score for impact, and then there'll be a score for each of these 5 areas through based upon NIH criteria. So we'll look at the importance of the research, so significance, innovation, rigor and feasibility, which would be approach and collaboration, and then expertise and resources, which fall under investigator and environment. Next. And then our external committee review will include representatives from agencies or organizations throughout the state who are committed to improving health, function, and quality of life for Wisconsin's older adults. Our ECRC will also score proposals, again, using that 1 to 9 scale based on 2 main criteria: the potential to impact health and or functional outcomes due to disparities and or inequities, and full engagement of community and or patient partners. So again, really, when Hungry talked about having description about your community partners, it's really important to make sure you talk about that. Next. And I think we go into question and answer.
Yes, awesome. Thank you, CAARN leadership for presenting on these different sections. I think we've got 3 potential applicants, investigators with us. We've got Dr. Fernandez, Dr. Zhao, and Dr. Shin all with us, who may be interested in asking a few questions about particular sections that we went over or maybe didn't go over, in which I can always pull information from the RFA. But also if you have questions about CAARN, we're glad to answer those as well. So feel free to jump in or send it in the chat and I can read it for you. Whatever works best, we can do that. And I did make a note earlier. I had a discrepancy on one of the slides. It said Monday, April 14th as a deadline for the full application. The other one was Friday, April 11th. I just wanted to confirm it. It is going to be Friday, April 11th for that deadline. So I'll be sure to go back and update that and make sure that's included, and just so there's not any confusion with that. Okay. Okay, yeah, go ahead, Dr. Zhao, go ahead and jump in here. I see your hands raised.
Yeah, thank you so much. This is very insightful, very helpful. So I have a question about the scope of this grant in terms of my research focuses more on people with visual impairments, and a large proportion of them are older adults. So if I'm interested in applying, should I say that my research contribution is like focusing on the low vision population, or it's more focusing on older adults?
I would focus on, you could mention the low vision population, but I would really describe the problem for older adults. And particularly if you're planning to work with a community that's been historically underrepresented, describing the vision population, the vision problems that that community has. So, for example, it may be increased incidence of diabetic retinopathy and vision impairment in African Americans, but you want to be clear on what types of disparities may be reduced. Does that make sense?
Yeah, yeah, absolutely. Thank you so much.
And we do recognize, I do want to say that we recognize that conditions and diseases related to aging may start at younger middle ages in communities that have been who face adverse social determinants of health. So we are not defining what older adult means, and you can make a case that people with visual impairment in middle age related to conditions that affect underserved populations are relevant to the research. So, but because this pilot is funded by NIA, and that was the purpose of it, it is really important to, and focus on the problem for older adults.
Yeah, that makes sense. Thank you, Jane.
The questions? Got plenty of time here. Maybe if we don't have a lot more questions from our guests here, I'm wondering too if we want to MPIs talk a little bit just about and this actually goes out for some of our staff too here that are joined us. Maybe a little bit about how CAARN works with investigators during a pre-proposal process. And I can, outline as sort of my role. And Hungary mentioned if you're interested in sort of finding out if your project's a good fit or just knowing where to start with community engagement, I'm a great person to contact because I can sort of do an initial consult with you and possibly invite one or two of our staff to learn more about the research, and then we can have you join our full team to sort of present, assuming that it's something you're still interested in and we think it's a good fit, to really describe and think about sort of your approach and initial engagement with the community that you intend to serve. So I don't know if CRAs or MPIs you want to talk about, sort of your roles in that and how you feel like maybe working with investigators is really during that pre-proposal process, how that really brings value to both the researcher's application, but also the community's role and feeling like it's addressing a need. So I'll be quiet and let some other folks talk about that. Feel free to just jump in. We've got a lot of CAARN folks, so you can introduce yourself if you haven't already, but
I'll start. Good afternoon. The pre-work of a CRA in helping with the preparation for you to submit your grant would be, identifying what areas or communities you would like to work with and where there is a need, and making sure that area is not oversaturated with the same type of project, or making sure that that community is going to welcome basically that project and that you're going to be able to be successful in your studies. I think that as CRAs, we definitely, rely on the trust of the community. So it has to be something that's vetted and something that we've pretty much been sold on, and we believe that is necessary as well before we will bring it to the community, because, the community trusts us and we want, to bring relevant information to them, as well as to make sure that the researcher is put in the best position, to be successful as well. So the pre-work is also, working with the CRA to make sure that everyone is on the same page. So that way we can assist in building that bridge with the community.
Very well said, Dorana. And I don't know if you mentioned Dorana, but Dorana is one of our community research associates, or what we call CRA, who works with the African American community in Milwaukee. And so she's actually also situated in the Center for Community Engagement and Health Partnerships, which is ran by Gina Green Harris, who some of you may or may not know. So you could see we have 4 key network partners who help us because of their connections and background and work and credibility with community organizations. We sort of rely on them to make this work possible because, like Dorana said, that's certainly where we want to start, is in knowing who to engage, because we need to know what your research is trying to address, and if that what you're trying to address is really a key need of that community. So
this is Carla. I'm a CRA with the African American Health Network. It's kind of loud where I am, so I will try to stay off mute, but Dorana did an amazing job on what we do. We've been with CAARN for 5 years, both of us. And we are definitely the connectors to the research and the community, that conduit, that liaison person that really helps the researchers, and even helps them even prior to that in regards to the AT technology, giving you suggestions and information on how it would be best used in our communities. And so I just wanted to add that part, and thank you for joining us today.
thank you, Carla. Yes, Carla does wonderful work with the Dane County community through the AHN. And just sort of to add to that, both what Dorana and Carla said, we use one tool that's on our website, and if you are interested in doing community engagement and facilitating partnerships through CAARN, we will use a tool called what we just call our researcher community engaged research intake form. And there's really a lot of value in that, because it also is it has questions on there that are really going to get at the heart of what Hungary was highlighting in the application sections. Many of those points sort of help you start thinking about some of those aspects in that intake form. So it's really not ever meant to be busy work for us. It would really help prepare for conversations with us, and then eventually the community partners, and getting the information that we need. And so we work with you if you don't always have ideas on or have answers for every question, but it's really a good starting place, and it's been really I think a useful tool for us so far. So that's something to think about. One thing maybe MPIs you could mention here is, does CAARN have to, or one question I have, does CAARN have to be the network partner or bridging partner to helping connect folks to communities, or I guess the question really is, do they have to work with CAARN, or is there opportunities if they have community partners already? Is that acceptable?
I can take that. Yeah, that's a good question. And they don't have to work with CAARN. We're just available to try to be of help in forming partnerships. However, if you already have existing partnerships, that's totally fine, or other connecting entities on campus that you're working with, for example, UW Extension, or there's a number of other ones. But we can help you as part of the reason why we encourage you to do just a consult with Will, is it can help you figure out, do you have your links to community partners? And we hope, at least by the letter of intent, that you have, you may not have the actual community partners, but you have some entity on board to help you, that's going to help you link to community members or community organizations.
Thank you, Jane.
Uh, do do PIs, I don't know if you can hear me, I was having some Bluetooth issues earlier. Cool. Do applicants need to do any training prior to applying or before or during the application process if they've not engaged with the community before? Is there any training requirement or any courses they need to do?
That's a good question, right? Not necessarily as part of the application process, but if you've gotten some training and want to write that as part of your biographical sketch or writing about your expertise, that's great. We will also, for awarded individuals, we will have a training both on sort of some of the principles of geriatrics, gerontology as they apply to, thinking about working with users and older adults, and also related to community engagement. And then there are some excellent resources on campus that we would encourage as well, that just help set a ground level for community engagement with historically underrepresented communities.
Thanks, Jane. I have another question, unless someone else has one. This is actually probably more for Hungary. So if I'm an engineer and I have an idea for a prototype, how far is this, I guess, is this funding, how much of it can be used to actually make the prototype? How far along in the research process of building the prototype do I need to be if I'm interested in this opportunity?
Yeah, thanks for this is a great question. So the project is 1 year. 1 year goes by really fast. And we do kind of want to see some outcome in terms of getting the feedback from the community, getting advice, and having some iteration in terms of the implementing those advice and the feedback. So if what you have in mind is only on the concept or still in the conceptualization level, that might not be most fitting idea for this project. However, it's not like you really have to have something that is already working perfectly either. So I would say the caveat or rule of thumb is that you have something that is kind of working, either is for for example, if it's a software that's working, that's running, if it's a hardware, it's actually doing some measurements. But you have some initial results. But now you're interested in seeing whether they can benefit the underrepresented and underserved communities in Wisconsin. You want to have some kind of feedback from them, advice from them, how to improve this design so that it can benefit them or fit more to their need. That's probably what you're looking at. So I would envision that there should be there should be some kind of improvement or refinement, because that's the whole point of taking these feedback and advice and then go back to the lab to improve it and to modify it based on this feedback or advice. But at the same time, also we will emphasize that there must be some kind of a testing or seeking feedback involved. So if the whole year is spent on making a prototype and say, okay, at the end of the year, we have a prototype, but we have not talked to any community members or we have not sought any meaningful feedback yet, then that would not serve the purpose of the project. So I would say that's probably the best answer I can provide at this moment.
Thank you, Hungary. I think that definitely helps a little bit more. Just provide some some framework to what we mean by developed.
There's one question in chat as well. Are there any restrictions, encouragement around cost sharing matching funding? There's not any restrictions. It's certainly encouraged, but of course, It is not a review criteria, but you should be clear to make sure that the budget fits the activities that you want to do, and then describe if there are any additional funds to support sort of the larger proposed activities.
Question. I have a question this could be for Barb, Dorothy, Jane. If I'm an engineer and I'm interested in collaborating, meaning I see the value of bringing on potentially another academic health science collaborator from a different school or department, what are some of the best ways to maybe get connected or know where to start with some of that if I'm not really connected well with some of those other schools? Where do I start?
Barbie, you want to go?
Well, I am also the co-director for the Center for Aging Research and Education, and we have multiple people across multiple departments and colleges at UW in our network related to aging. So there's that possibility that we actually might know somebody that would make a really great partner on a assistive technology project. So there's that option. To think about who's out there and who's in this space. What are your thoughts, Dorothy?
So I'm the Associate Dean of Research for the School of Education, and I really work primarily with the health-related departments and the arts. But I also work with other associate research deans in the School of Human Ecology and the College of Letters and Sciences and the College of Agriculture. So I think within or among our MPI group, we're really well connected in the aging research community. And if you come to us, we can probably find an appropriate partner. For example, in the School of Education, we have the Department of Kinesiology, which includes occupational therapy and exercise and movement science. We have rehabilitation psychology, really interested in interventions that support the health and well-being of individuals with disabilities. We have counseling psychology in case there's some kind of an intervention, a technology that might support emotional well-being. So I think between Barb and Jane and we can help you find someone who could support your work. And it's similar to the kind of matching and matchmaking that we do with community partners. We're here to help because we want to really see strong pilots and good collaborations. So just ask. You might get more than you bargained for, we might bombard you with suggestions of great partners to work with.
Thank you, Barb and Dorothy. Other questions folks have? I can keep them going. Carl asked, will the slides be sent? We talked about, I think sure, we can have a lot of the slides are covered in the actual request for applications, but I think having them available and I can send them out to those that registered after this too.
Another resource available for investigators is actually through ICTR, and the group that helps with protocol development, which includes the Collaborative Center for Health Equity. So there's help there too, and connections to community resources and potential partners as well. So we have a lot of resources supporting this project. We just need to know what you need to know, and I'm sure we can help find good sources of support and information.
So we've got about just about 5 to 7 more minutes here. I was wondering maybe I could get the Carla one more. I was wondering if you had any words of wisdom for investigators. I think that as a CRA or Durana too, excuse me, if you're a researcher and you're new to community engagement and working with communities as equal partners in research, and you really want to do it in an authentic and meaningful way, is there any words of advice you would have for researchers as they sort of, endeavor to maybe start doing more of that?
I would say keep an open mind, you know, be open and just you know, be open to receiving feedback. And don't be discouraged from the feedback that you do receive. You know, just you know, take it and apply it.
Right.
That's all
This
I
is
have.
Carla. I would say definitely that same thing. That this is a new field, a new area for communities, especially communities, marginalized communities, communities of color. And so, however, listening to their feedback and their own narratives and their expertise and opinions, even though they may not be as skilled or at that educational level in regards to AT, but their wisdom and knowledge means a lot. And so we have CAARN with our researchers, with our MPIs, and definitely are amazing in how we get the work done and get the work done collectively together in communities. And so I think that's what the key word for me is collaboration and collective movement in a project, not only for you, the researchers, so you can get some credit and you can, next thing, you're at the Nobel Peace Prize, but also is that our communities will be better for it. So that's what I would say.
Yeah, I want to speak to the importance of that. So even those of us who are very experienced community engaged researchers benefit from the partnership on every new project. I was fortunate enough to have Carla Peterson-Gaines work with me on a long COVID study. And again, I'm pretty well connected to the community, but I could not have done the study without her. And in addition to her work with me, helping to figure out our recruitment strategy and actually working directly with community members on recruitment, she did some training for my graduate students and my undergraduate students to prepare them for engaging with people from the community. She made some really important recommendations and changes in our recruitment materials. She helped us do some health education about long COVID before we started recruitment. And without her, we recruited 185 people in 6 months, with about 35% were African Americans. She helped us arrange for community testing locations for people who are uncomfortable coming on campus. I couldn't have done it without her. And those are the kinds of things that CRAs do as part of their job, plus helping to create community advisory boards. They're such an important part of the research process. I just can't say enough things about them. And so if you haven't ever done this work before, it's a great way to get started with great support. If you've done it before, but you're working with a new group, it's a great way to connect with new community partners. It just enriches our work, which is why I believe that NIA funded this project, because it's so different than what's been done previously.
Very, very well said from all three of you. And just to really hammer home some of Dorana and Carla's points is that you don't need to be always the most knowledgeable or the top at anything, but having an open mind and being willing to listen and do it in a meaningful way is really gonna be really, really beneficial for the project and really your ability to connect with these communities and have sustaining partnerships. So so we just have a couple of minutes left. I just want to provide any other last time for last questions from the investigators or prospective applicants, and or any wisdom from the MPIs or CRAs. Or we have Kat Phelps too, who's a wonderful partner of ours in the winners group in the School of Nursing. So if you have any thoughts too, we'd love to hear before we sort of close out this session.
Oh, I have nothing to add. Everyone has spoken eloquently.
Sounds good, Kat.
I'm proud to be a part of the team. Thanks.
Mm-hmm. So, okay. Yeah, I think if there's nothing else, I think we can sort of close out here and if again just sort of reminding everyone if you are interested in having a consult, I know a few have already who's here, so they're already on their way. But if there's other applicants who or prospective applicants that are interested, feel free to reach out to me directly and we can kind of start on that. Or again, if you just have more questions or need clarity on things, I'm happy to do that or connect you with someone if they're a better person to ask. And we just really appreciate you interested in helping spread the word. If you know other researchers who are doing the similar work that may not have seen our announcements. So we're excited to offer this for our first year, and we'll be planning on offering this for the next 4 years and hopefully beyond. But we're really excited and hope to see more of all of you and see your interest grow. So anything else as we close out? Okay. Thank you for everyone's time and thank you again, researchers, and you have a wonderful holidays and we'll look forward to maybe hearing from you at the end of this year or at the beginning of the new year.
Thank you.
Happy holidays. Happy New Year.
Take care.
Stay
Take
safe.
care. Bye-bye.
Bye-bye.